I think we'll get going. So welcome everybody to this lunch event. In fact, it's a dinner event for me, but that's fine. And we're looking deeper at a research agenda for sanitation workers. So you've seen a few things in the agenda this week relating to sanitation workers. This session is specifically really to try and get feedback from all of you as participants about some of the research priorities for sanitation workers. Next slide. So here's how things are going to go. Our objectives is to really to get closer to understanding what the issues really faced by sanitation workers are, to really call on you to contribute to generating these research ideas in a two-step process. And for you to kind of know more about research opportunities you might find. You're looking here at some of the beautiful photos that were generated through an exhibition curated by WaterAid. You're going to be seeing lots of these images and voices as we go along. You'll actually notice that they're quite Africa focused in this particular presentation, but in fact, the issues facing sanitation workers are by no means limited to Africa. It's a big issue in South Asia, Latin America, in fact, all over the world. So please don't let the images limit your thinking to issues in Africa. Please also have your phones at the ready. We will be sharing a QR code for you to use at the end to do a more in-depth survey. So here's what we're going to do. We'll have a quick overview of the Sanitation Workers Initiative from Andres at WaterAid. Sophie is going to give a summary of what the overall protocol for developing the research agenda is. And then we're going to be really trying to tease out some of your ideas about research priorities, working with 4 inspiring panelists who are going to give us their initial perspectives. And then we'll wrap up by directing you to the full survey. So I think now we are going to kick off though with the voices of some sanitation workers from Tanzania. Sophie, if you could perhaps show us that video. We're not getting the sound.
Depuis 2009 que je me suis lancé dans cette activité. Mais les difficultés que j'en ai rencontrées, il y en a beaucoup. Non seulement l'incompréhension des vidageurs manuels. Ils ne savent même pas que ce qu'ils font, c'est un travail noble qui nourrit son homme. Ça, c'est la première des choses. La deuxième des choses est que l'État même, vis-à-vis de sa population, n'a pas un œil regardant là-dessus. J'ai décidé de vacciner. Quand j'ai vu les vidageurs manuels pour qu'on travaille ensemble, mon objectif premier était de les vacciner. Parce qu'ils se blessent dans les fosses. Vu que les gens jettent les seringues, les couteaux, les objets tranchants, tout ce qu'ils ne veulent pas, c'est ce qu'ils jettent à l'intérieur de la fosse. Donc, on a d'abord fait ces vaccins pour se protéger d'abord. Et ensuite, essayer de trouver des matériaux d'équipement de protection individuelle pour les vidageurs manuels. Et une latrine VIP est égale à une latrine construite et séparée en deux. Et pour vidager ça, si tu ne connais pas, tu risques d'être tué par le mur qui sépare ça, qui sépare la fosse. Nous avons aussi essayé d'approcher les autorités pour d'abord valoriser l'activité de la vidange manuelle ainsi que les vidageurs manuels. C'est que moi-même proprement, ce que j'ai fait pour la conscientisation des vidageurs manuels était de faire comment? D'abord, les inciter à se protéger avant de travailler. Il faut d'abord se vacciner. Après avoir été vacciné, il faut se protéger en faisant quoi? En portant les gants, casques, verres, cache-nez, bottes et imperméables. Ce qui a beaucoup impacté aussi, c'est qu'aujourd'hui, si il y a quelque chose qu'on va parler sur l'assainissement ainsi que la vidange, notre association est sollicité, est invité à participer à cette rencontre. J'ai été très content quand le ministère de l'eau et de l'assainissement nous a décoré le 16 décembre 2017. C'était vraiment une fierté pour moi et cela me réjouit. Un vidangeur manuel qui a été décoré, c'est du jamais vu. Seulement les ONG à Ouagadougou ici, œuvrant dans le domaine de l'assainissement, s'ils pouvaient aussi, c'est vrai, nous on vient vers eux, c'est eux qui n'ont pas notre temps, si on peut bien le dire comme ça, parce qu'on a fait des demandes par-ci, par-là, on a déposé depuis 5 ans aujourd'hui, on n'a même pas eu de réponse, on n'en parle pas quelque chose de concret comme ça. Donc nous demandons à ces ONG-là de nous ouvrir aussi leurs portes pour qu'ensemble nous travaillons. C'est en travaillant ensemble que nous allons faire bouger les choses. Sinon, nous, en tout cas, on est limités. Vraiment, j'aurais voulu souhaiter que si les ONG peuvent nous aider à nous structurer, parce que les vidangeurs manuels, c'est des gens qui sont là. Compte tenu que leur métier est sale, ils ne veulent pas se présenter.
Wonderful. And sorry, that was Burkina Faso, not Tanzania, as I said. Right, I'd like to hand now to Andres Hueso from WaterAid, who's going to give us a quick overview of the broader initiative on sanitation workers. Andres, please.
Thanks, Kate. So I'm going to just provide a bit of background to where this session is framed. So if we go to the next slide. So the motivation for discussing the research agenda on sanitation workers is because this is a topic that has been overlooked, has been under-researched, despite the fact that sanitation workers provide an essential public service, but they do that many times at the cost of their health, safety, and dignity. And they are most often invisibilized, like hidden rather than visible, and quantified and ostracized, particularly in countries where there are also caste or religious dimensions to this work. And when we say sanitation workers, we are talking here about those dealing with fecal waste along the sanitation service chain. So from pit emptiers, septic tank, toilet cleaners, dry latrine cleaners, sewer cleaners, and fecal treatment plant operators or wastewater treatment plant operators. Next. So the initiative of sanitation workers is initially was made up of ILO, WaterAid, the World Bank, and WHO. And a couple of years ago in this same conference, we presented the report, Health, Safety, and Dignity of Sanitation Workers. And that was the first global effort to put together the evidence on sanitation workers at this scale. And there were, it's difficult to summarize all what came out, but some of the key challenges that were highlighted were weak legal protection and multiple occupational and environmental hazards, the informal nature of work and financial insecurity, and social stigma and discrimination. So those are some of the key challenges facing sanitation workers. And the report recommended 4 broad areas of action: policy, legislative, and regulatory reforms, development and adoptions of operational guidelines, building the evidence base, and that's part of what we want to advance today, and advocacy and empowerment of sanitation workers. Next slide. And after that, we started a global advocacy project, also the same 4 partners plus SNV, rebranded as the Initiative for Sanitation Workers. And we got additional support, monetary support from BMGF, the Bill and Melinda Gates Foundation, to undertake some of these activities. So the objectives include there are 3 broad objectives, one around political prioritization. So that's about supporting the inclusion of sanitation workers' rights in government and civil society political agendas at national and local levels. Second objective around influencing the WASH and labor sectors. That's about mainstreaming sanitation workers' rights in WASH sector implementation and monitoring and in initiatives of the labor sector. And finally, the third one is addressing knowledge gaps. That's about supporting research initiatives and products that address those gaps. So quite aligned with some of the action areas that we highlighted from the earlier report. Next. So we have a lot of activities are organized around those three objectives to the left, and the ones that the ones that are more relevant to these conversations are 8 and 9, about developing a research agenda and primarily, and then a bit about incentivizing research. So I'll give a couple of details about those two. Next. So this is about the activity, developing a research agenda on sanitation workers issues, is being led by WHO, and they will talk a bit in more detail about it, but it's basically about preparing a research agenda that highlights the key knowledge gaps and that we want to develop based on consultations with a diverse group of stakeholders and decision makers. And the idea is that is an important step in terms of addressing the knowledge gaps, is having a consensus-based or an agreed agenda, so that we all know what we want to find out. Next. And then just to briefly mention that another activity part of this project is incentivizing research. And we have two main activities. One was happened yesterday in the opening plenary, where the awardees of the research award on sanitation workers were announced for the best original papers and best published papers. And you can see there the link with the information about that, and I will also put it in the chat box. And then we have also grants to support research for master's and PhD students, and also institutions that are doing or interested in doing research on the rights of sanitation workers. And we are finalizing the evaluation of the proposals. Thanks. We can move to the next slide and presenter. Thank you very much.
Thanks, Andres. So just to say for all of you, please do look out for all of the wider stuff around the initiative, and there will be a website coming soon. But for now, I want to pass over to Sophie to present the protocol for developing the research agenda. Please, Sophie.
Thanks, Kate. So in the next few slides, we'll keep it very brief, but just to give you a very quick overview of the protocol that we've developed to conduct this research priority setting exercise. So just very quickly, I just wanted to highlight that it follows WHO guidance, which is a document that was released recently last year that really provide a systematic and transparent process for developing a research agenda. There are 6 key steps, which are here on your screen, from defining the objective and scope, reviewing what has been done before, setting up an advisory group, which will provide input to the protocol and the results, agreeing on the methods, whether it's a consensus or metric-based approach or a mix of both, implementing the approach, and finally analyzing and publishing the results. So the objectives is really to provide a framework and institutional guidance for mapping and coordinating research activities, but also ensuring that research investment are effectively targeted. The process aims to engage decision makers and stakeholders in generating this research agenda, both at global and national level, but also the third point is to raise awareness on the health risks faced by sanitation workers and the adverse working conditions of their work. So we started by doing a very some literature review of what has been done before. So we've been collaborating with Emory University on a systematic review looking at occupational health risks among sanitation workers, which Emali will be talking about briefly after this. But we also conducted a very rapid review to map out the different research dimensions. So we looked at 34 publications, which highlighted the different dimensions that are highlighted here in the box. So of course, occupational health, the quantification and the profiling of sanitation workforce, some areas around technology, behavior change, policy, regulatory and legal issues, institutional arrangements. We're also looking at issues of root cause of marginalization, gender aspects, and so on. So I won't go into much details, but you could see that this is cutting across a wide range of areas. So we wanted to settle on the methods for doing this exercise. So there was this paper published by Yoshida in 2016, which really looked at the approach that have been used for conducting research priority setting exercise between 2001 and 2014. They identified 5 common standard approach. There was a mix of, again, consensus, metric-based approach, or a mix of both. But the approach that really stand out was the Child Health and Nutrition Research Initiative, which was used in most of the publication that were identified. So that's the one that we decided to follow. So very briefly, the key steps are, so first, the whole process is based on having a group of stakeholders that are representative in terms of disciplines and geographical areas that can provide some input and feedback throughout the process. One of the initial steps is to solicit research ideas from researchers, but here also practitioners, policymakers. We aim to have a wider range of stakeholders involved. Then once those research ideas are collected, they're consolidated into research questions, which are then sent back to the same group stakeholders and respondents to score them against some predefined key criteria, which are used for the prioritization. So criteria including answerability of the research questions, the deliverability, the maximum potential for disease burden reduction, or the effect on equity. So in the first step of the process in soliciting research ideas, these are grouped into 4 main domains. So the first one is really the description of the problem. So what do we need to know about the risks and challenges that sanitation workers face? The second one is around delivery. How do we improve implementation of current approaches to maximize their impact on health, but also on other dimensions and conditions of sanitation workers? The third one is development. How do we improve the acceptability, affordability, scalability, and sustainability of existing interventions? And then lastly, the fourth one is discovery or innovation. What new thing would be a game changer for improving the condition of sanitation workers? So in the next session, we will get an opportunity to talk about research idea under each of these domains. So I will hand over the next part of this session to my colleague Abisola, who will take us through those 4 domains. Thanks.
Hello, everyone. Thank you so much, Sophie and Andres, for setting the stage and explaining why we are doing this work. So as Andres suggested, now we're going to be going through like a discussion section with panelists that we've chosen to represent these 4 domains Sophie mentioned. Next slide, please. So the first one is description of the problem. And as Andres and Sophie said, we had carried out some work to understand the occupational health risks and just to understand what are the issues and challenges faced by sanitation workers. So our first panelist, Emily Oza from Emory University, is going to let us know what do we need to know from our own experience and our research about the risks and challenges, especially the ones relating to health that sanitation workers face. How do we, what are the key research ideas for this domain? Emily?
Hello, thank you. Can everyone hear me all right?
Yes.
Awesome. Thank you. Okay, so good morning, afternoon, or evening, depending on where you are. Thanks for joining. So my name is Himali Oza, and I'm a doctoral student at Emory University at the Rollins School of Public Health. So, we've been talking about sanitation workers are an essential part of our societal and global public health, but the health risks and outcomes of these workers that they face are not fully understood and not well quantified. So as Sophie mentioned earlier, my colleagues, Madison Lee, who's a current Rollins MPH graduate, Frank Pega, Kate, along with Sophie and Tom Clausen, have recently submitted a systematic review of 65 studies on the occupational health outcomes among sanitation workers exposed to fecal sludge. So here I'll briefly describe the gaps in current research in areas that need more evidence. So overall, the consistency of evidence suggests that sanitation workers are an increased risk of gastroenteritis and respiratory conditions, and maybe at an increased risk of musculoskeletal disorders and mental and social health conditions. However, there are many limitations and risk of biases. So all included studies in our systematic review were observational studies, and most used a cross-sectional study design. There were also few studies that directly assessed occupational risk factors exposures directly, and studies that did not assess the exposures directly relied on the certainty that sanitation workers were exposed based on their occupation or based on personal recall. So this raises important issues of recall and measurement bias. The review also highlights the gaps in research characterizing the health risks of sanitation workers among low-income countries, women, and those under informal employment as sanitation workers. So there were no studies from low-income countries that met our inclusion criteria, despite a widespread report of the large number of sanitation workers in low-income countries. And this is important because sanitation workers in low-income countries face special risks that are usually due to lack of legal protection, access to personal protective equipment, access to adequate healthcare, and other safeguards. Furthermore, only 22 of the 65 studies that met inclusion criteria focused on 22 of the 65 studies focused on male workers, whereas only 2 focused on female workers. In certain countries like India, women make up at least half of the urban sanitation workforce. So I think it's really crucial that we actively include women in sanitation worker studies, especially to better understand the different risks they may be facing. We also identified no studies that described the working conditions or the burden of disease faced by sanitation workers who are informally employed. This is another clear gap in the current research. Many sanitation workers, especially in low-income countries, are informally employed, and therefore they're difficult to localize. So this is especially important because informal workers, they don't have legal or formal safeguards protecting them. which is exacerbated by their lack of access to healthcare. These workers are off. Sorry?
Oh, sorry. Go ahead. I just wanted to
Okay.
get it through.
Okay. And then these workers are also often exploited. So lastly, social stigma is also a big factor that impacts sanitation workers, especially those that are informally employed. They may be social stigma is often superficially acknowledged or understood within many of these studies. And so we need to closely examine the process and implications of social, societal and cultural norms and beliefs that exacerbate risks or prevent things like appropriate pay, access to PPE, or access to healthcare. Thank you.
Thank you so much, Emily. While Emily was talking, she mentioned a lot of key challenges facing sanitation workers. So I just want you in the next 5 minutes to just suggest in the chat box, passable chat box, what other key research ideas relating to that we could look at relating to the challenges or understanding the occupational health risks amongst other risks to livelihood, to health, productivity that sanitation workers face. Okay, so I think I see a suggestion from Sudhir on his opinion on the questions for organizers. He mentioned something about PPEs for hot weather, sludge on site treatment to reduce disposal costs. I will just, Sudhir, can you give us a more detail on that? Is that relating to what Emily said or just your general opinion?
Just a general opinion.
Okay, all right, thank you. So I'm going to go ahead now and next slide, please. Oh no, sorry, this same slide, it's okay. So our is a sanitation specialist from World Bank. Could you also, just like Emily has said, just let us know other challenges and risks faced by sanitation workers that may not be health related, but affect them a lot?
Thanks, Bisola. Hi, everyone. Awajian, I'm a water supply and sanitation specialist at the World Bank. I think Emily mentioned a lot of the challenges that we also identified when we were working on the initial report, and Andres had actually presented some of them. So I don't want to repeat. Maybe one thing I can do is that in the second phase of the work, we tried to fill in some of those knowledge gaps that we encountered, and two of them are on guidelines in general. So on the legal, regulatory, and institutional frameworks, what are some of the elements that we should have in these laws and regulations, but also on the policies, that protect sanitation workers? But also, how do we move from paper to practice? Because a lot of things that we see is that these documents exist in most countries, but then they're not implemented. So how do we make sure that we move from this paper to practice, basically? That's on the, let's say, how do we protect them on the policy, institutional, regulatory, and legal side. Then when we're also undertaking a review of technology, and I guess someone just mentioned it, which is on the PPE. So we've also noticed that there are a lot of gaps when it comes to technology. We looked at a framework of the different hazards that they face. Are they physical, microbial, but also on the hazards that are inherent to the fact that they work in confined spaces. And we also looked at it in the terms of the entire service chain, not just those working on-site, but also those working on sewerage, those that are working also in treatment plants. And what we noticed is that there are a lot of gaps when it comes to the different hazards they face, whether the technology is not controlling the hazard fully, that they're still in contact with microbes, but also that the fact that the technology may not be suitable for their work environment, but also the weather they work in. again, the discussion on PPE, like what is the right PPE for certain types of weather, but also what is the right equipment to use. No, some of the equipment may not be feasible for some types of workers, but also do they have the wellness facilities that they need either before or after their work. So there are a lot of questions we still have while we're trying to fill in these gaps basically on these different aspects. Thank you.
Yeah, thank you so much, Awa. And as you were talking, it just occurred to me that we can't even as much as we are creating or trying to understand research priorities, we have to think of the context of work and the geographical location. You just mentioned a valid point that when thinking of PPEs, you have to think of the weather. It could be applicable to some areas and not so much applicable to other areas. So this is a nice suggestion. Thank you so much. Anthony, I'm going to just read out your chat. You were also talking about what Sudhir said on understanding the crossover in the labor force between clearing drains and dislodging on-site sanitation as an important research question. So this just wants me to, I want to ask a follow-up question on what do you think is the key research need for quantifying and profiling the sanitation workforce? How would you see this need for, and what would you say would be the benefits for doing this?
I think this is a question we've had since the beginning, because when we started working on this subject, the question we still have is, so what? Like there is this so what that we need to come up with better evidence that this is a large workforce. And if we want to reach the SDGs, we have to understand that this is a workforce that is also needed. No, but the fact that it's mostly invisible, we don't have this data to back up our arguments is something that I think is very important. I mean, there are other aspects to it, but for us on the advocacy side, but also on the projects that we finance, we need to make sure that we come up with this evidence that look at all of these people that are impacted basically by our financing, their health, their safety, and also their dignity is also impacted. So knowing, having more data on this aspect can really help us move in this agenda. As a donor, I would say, maybe our other partners also have maybe an answer for that, but for me, I think this has been the challenge we've been facing basically, the fact that we really don't have this data available.
Thank you so much, Awa. So Awa and Emily has shared such a great deal on us, how we can describe the problem and what research ideas will be key to doing this. So could you please include in the chat your comments or research ideas relating to this domain in the next 1 minute before I talk much more on the second domain. Okay, Katie also included some suggestions in the chat box in terms of how many workers are out there, how many do we need to achieve? I don't know what SNS is. Katie, what is that?
Safely managed sanitation.
Okay, safely managed sanitation. What will make the work attractive to newcomers to the sector, amongst others? And Zachary also talked about whether it is important to take into account gender when designing PPEs. Yes, because if the PPE isn't acceptable for use, no one will use it. Then Mariam also mentioned that we need to discuss how relevant and realistic are the current improvements organizations are trying to achieve in terms of occupational health and safety. How those plans and designed equipment will be implemented and sustained. Thank you so much, Mariam, for this. You jumped the gun. We are going to discuss this in later sections on delivery and just ensuring that we create interventions that are sustainable. And Emily also mentioned that another thing that she didn't mention is due to time was the effect of substance use while working and how that impacts or is a space risk. Thank you. Can we move to the next section? Domain, I mean. So now we want to talk about delivery, and we are all concerned about how interventions are delivered to improve sanitation workers' health and productivity and livelihood. So now Sally is going to join us as our panelist, and she's going to shed more light on what are the approaches or current approaches that we can improve to maximize their impact and meet the needs of sanitation workers. Sally, over to you.
Thank you so much, Priscilla, and hi everybody, and nice to see you all today. So I'll be talking briefly about the delivery component of the framework. So just to give a bit of background, I've been working on the topic for the last few years, particularly from a social science perspective, looking at livelihoods, looking at alternative livelihoods and ways in which to improve the work from manual work especially. And also been looking at some of the intersections around gender, caste and religion in terms of how that shaped work for sanitation workers. And also looking into labour violations, including sadly sewer deaths, as well as injuries in sanitation work. So that's what I've been doing the last years with WaterAid as a partner. So I want to talk you through today in a more kind of broader conversational tone really around delivery, and particularly how well current approaches meet the needs of sanitation workers. So please do put your comments in the chat if you have particular research questions or thoughts on this. But just to kind of keep it quite broad and to kind of prompt a discussion on this area, we obviously know that there's a great need to actually understand what approaches already exist to address the needs of sanitation workers. But we also need to think about who's promoting these approaches. So is it government-led? Is it NGO-led? Is it from workers themselves? That's one thing to think about. What are the institutions that are behind these approaches? What financial resources do we have to support them? And what political support do we have as well? And that seems to be really important. So are we talking about national governments? Are we talking about state governments? Are we talking about lawyers? Are we talking about grassroots activists? So I think there's a question around who's actually putting these approaches forward. Crucially, we need to understand better what these needs actually are of sanitation workers, and that includes ways and methods in which to actually engage sanitation workers in the process and ensure that their priorities are put at the forefront of research. So there's really broader questions around how we could actually do that. And then there's questions around measuring these existing initiatives and approaches, and again, in terms of how effective they are, if they have any unintended consequences, and that's something that colleagues like Mariam, who's here in the call today, have looked at in the past as well, in terms of any consequences around job loss or income loss. So we need to also think critically about that when we're looking at different approaches too. And there's a couple of things just in my own work that I've seen in terms of potential gaps in looking at needs and priorities. And again, the same issues seem to come up, especially from sanitation workers in India and Bangladesh, around job security, so looking at permanent contracts, looking at challenges around subcontracting and regulating those kinds of sectors. So looking at how we can actually approach mental health among sanitation workers, not only in terms of addiction, but also sadly in cases of suicide because of lack of timely payment or irregular payment, and that is actually something that's quite underreported. Looking at work benefits, again, not only at wages, but also looking at paternity or maternity cover, looking at overtime, annual leave, looking at health insurance, and also how workers are organising collectively to actually try to lobby for rights themselves and trying to understand how these sorts of approaches have actually resulted in any benefit to them. And we know there's also some examples of already kind of best practice around the world, including the Garima Scheme in India, which you must have read about, and also the work in Bangladesh on occupational health and safety among many NGOs, including the FSM network. We've also got amazing campaigns such as the Sweepers of Superheroes in Pakistan, which is led by kind of legal activists as well. So I'd really like to just broaden out and say, well, what approaches are we talking about? What are the needs that we're talking about? And how can we maybe better understand the impacts of these? And how can we move forward to look at these different effective approaches for sanitation workers, keeping them at the center of attention?
Thank you so much, Sally. I just have a quick question from what you've said. You've mentioned so many interventions that are already working, especially in the behavioral sphere and socio-ecological interventions. Could you just describe one or two for the purpose of the crowd? I mean, what is working and what we can leverage upon to improve the delivery of interventions? Because sometimes this answer may not be in creating a new shiny toy that works, but in improving what we already have. So how do we do that? And what is working currently?
Thanks. I'd actually like to broaden that out to the audience. I think we'll probably be able to pool our knowledge a lot better. But I think one thing that I'm keen to learn about myself is the Garima scheme, which is in Odisha in India. And I think that's hailed to be positive because it not only looks at one issue among sanitation workers, like health and safety, which is crucially important, but it also looks at wages, it looks at worker benefits more broadly, it looks at the gender dynamics in the work, and also different ways to support workers. So I'm not saying that is something that we must follow, but there is a positive example, I think, there in terms of looking holistically at sanitation workers, including also where they're living, because many live in very dense low-income settlements, especially in South Asian context. So having a more holistic approach, I think, is a benefit.
Yes, thank you so much, Sally. Now I'll go ahead to read some of the suggestions we have already. I'm going to start from Bethany, who commented on what Emily had earlier said. That a great point, Emily. Valerie Bruza noted this in our FSM oral presentation yesterday. People reportedly provide alcohol to those emptying their latrines or using when emptying themselves, so those engaged in the work in sanitation workers use. So this is based majorly to the point that was made for description. So on gender points, Bethany also said it would be useful to understand the types of work available and attainable by gender. And sanitation work is stigmatized, but even within the work, there are levels of stigma. Women may not have the same opportunities in sanitation work as men. And of course, there's need to consider intersectionalities by caste. Bethany, would you be willing to shed more light on this? Okay, I'm just going.
I don't think...
Sorry, I was not aware that I could be unmuted. I just wanted to congratulate everybody on the really good work. And I think I want to hand it over back to the other commenters. I think that the points are in the chat. Thank you so much for this.
Okay. So now I'm going to, sorry I called you out. I just thought what you wrote was very interesting. So I'm going to read the last comment by Zachary. So he mentioned, Lisa and Bethany totally agree, the intersection of social stigma and gender is integral to ensuring dignified work for sanitation workers, especially in South Asia. Let's move to the next section. Next slide, please. Thank you so much, Sally. So now Sudhir is going to talk more on developments, or how do we improve the scalability, acceptability, and affordability of interventions. Due to the sake of time, Sudhir, please, we would appreciate if you could just round this up for us in like 3 minutes so we can have more time for discussion.
Sure, not a problem. Abby, if you could just unshare your screen, I'll just do mine quickly. Here you go. Can you guys hear me? Okay, so I just wanted to show you some of the things we discovered in South Africa. Usually PPE is difficult. People, when they need to take breaks, you can see it's hot weather. When it's hot, I've emptied up pits myself, and I'm telling you, you can only work for 2 hours. When they need to take smoke breaks, you can see sludge on their hands, stands in pants. You know, corrective measures for actually using PPE and knowing that sludge is a dangerous substance. Biohazardous substance. You can see people leaning against
Sudhir, I think there's a breaking from Sudhir's network. Can we move? Can we give him a minute to see if it comes back, and if not, we can move on to the next session and come back to Sudhir. Can you Moderator, can you keep sharing the screen, move to development, and then we'll come back to Sudhir. Okay, next slide. So now we are going to talk about discovery. We'll go back to talk about development once Sudhir has, once it's back online. So now I'm going to hand over to Rosie Renoff, who is a consultant with World Bank. She's going to let us know what are the new knowledge or things that would be game changers for sanitation workers, because we all know that the capacity to innovate is very integral in any field, and there's need to create enabling environment that will support knowledge, which will lead to interventions that are sustainable. So Rosie, what, from your own experience, what do you think will be the innovative things to do to change the lives or to improve the work of sanitation?
Hi, so thanks. It's nice to be here online. Again, just to kind of give a bit of background, it was mentioned earlier that there's obviously quite a few different work streams going on. I've been particularly working on the procedures, guidelines, regulations side of things. So that's the angle that I'll be taking just the next few minutes. So just to reflect on discovery/innovation, I don't think it's particularly new to say I don't think there's one particular silver bullet or one thing that would really change the game radically for all kinds of sanitation workers in all locations. Obviously, there have been a few things that have been mentioned already. So, for example, PPE that actually fits different contexts, different weathers. I'm sure there'd be quite a lot of things in the chat that would be related to that. But just thinking about it more broadly, I think taking a particular lens would be suggesting that it wouldn't just be about making sure that all sanitation workers are safe and the work is dignified, but really trying to make sanitation an attractive career that offers the people working in the sector substantial benefits. So, I mean, just thinking about it in terms of what I'm sure everyone on the call wants from your job, stability, decent pay, benefits, good working conditions, that includes on-the-job training, skill development, obviously a safe working environment, as well as being positively recognised for the work that you actually do. I think also, crucially, I think the freedom to be able to leave your job behind when you go home, and you can kind of leave it at the front door, as it were, which a lot of sanitation workers can't really do at the moment. I think also being able to find a new job, either in sanitation or in another sector, is a really important thing that we need to consider as well. Just the ability for sanitation workers to have these really marketable skills and experiences in a recognised industry, I think that would really help. Again, these aren't necessarily innovations. I don't think it's necessarily an innovative thought process, but I think research that could unpack aspects of how to achieve this move from unrecognised, unprotected and misunderstood work to making sanitation more akin to a really formal career, I think that'd be really useful and positive. So, I mean, that could include research on things like connecting international labour rights and movements, specifically to sanitation, definitely to informal sanitation workers who are being overlooked. Maybe that could lead to identifying recommendations for advocacy and for activists, as well as policymakers, about codifying those rights and making sure they're on paper, which would then hopefully lead to research that could then, as Awa mentioned, going from that paper to actual practice and making sure that things that are on the statute books are actually being implemented and are actually useful to the sanitation workers on the ground. It might be really interesting to think about or learn from multinational organisations that already exist, like, for example, the Container-Based Sanitation Alliance, maybe the Pan-Africa Emptiers Association. I know that some people are already doing some work on that, which could be really interesting to go into a lot more detail about how those have been kind of pooling that international experience, is maybe pushing for agendas in particular countries, and potentially looking a lot more about in particular cities where different organisations and different kinds of sanitation workers have come together, trying to learn from those experiences and seeing how sustainable they are, I think would be really useful. Something that I don't think has really come up as much, I think it might be really useful to know about what kind of standards that customers expect. I think we obviously talk about sanitation workers a lot, we talk about sanitation work and policymakers and that kind of thing, but obviously customers and the people who are paying for these services will be another pretty key stakeholder group that would be quite interesting to try and think about that intersection of groups a bit more. I mean, what kind of messaging do customers respond to about their role in upholding safety of the people who actually come to their homes and empty their toilets or process their waste? These are just some initial thoughts. I just think it's useful to highlight that innovation doesn't necessarily mean technology. I think in some places it could be something as simple as making sure that people actually are working on a contract, and a specific contract that includes a clause about all employees must receive proper PPE, and making sure the onus is put on their employers to actually provide and replace that kind of PPE. And just making those connections between sanitation workers and policymakers, I think would be really useful. So sanitation workers' experiences in turn kind of shaping the responses that come from kind of higher level interventions, and just also noting that I think other people have mentioned sanitation workers is such a broad category, and I think really trying to learn from, for example, the female sanitation workers in India and seeing how, and actually using their experiences to shape higher level policy change and legislative change, I think would be really useful.
Thank you so much, Rosie. And you were lighting up my head when you're bringing up so many. I really like the fact that everyone in this group, like, we all think holistically, and we can't just focus on one dimension. We need to approach this issue of resetting research priority from different angles. And just to speak to Zachary's point on protecting against social stigma, perhaps we need to think of innovative approach to protect against social stigma, given the fact that some of the stigma happen in informal sector and it's so hard to monitor or regulate. So we need to think of how we are going to do that and scale it up to other places. Does anyone have any? Okay, now I'm going to go back to Sudhir. Sudhir, could you, the previous slide, please, moderator. Thank you so much, Rosie. Let's go back to development. Sudhir, can you talk more on this? You were talking in the chat about some of your ideas. Could you let us know here? Okay, it seems Sudhir isn't online.
On the call, I think his connection is bad.
Yeah, thank you. I would like to round off the segment. If anyone has any shout out or something you would like to talk about in terms of research idea, please enable you put it in the passable chat. We will go through them and ensure that some of your views are documented. Now I'm going to hand over to Kate, who is going to moderate the next section of the session. Thank you.
Thank you, Priscilla. So I think we've got loads and loads of food for thought there. And so this is really the start of the process. There is a more formal survey that's been developed. So if you have your phone with you, please take it out right now and scan this QR code. That will take you to a more in-depth survey, and would really encourage you to take the time to really consider these questions and provide us with these research ideas. Your contribution is really important towards shaping this research agenda. The more kind of ideas and suggestions that go into it, the richer it will be. So please do that. As was mentioned, it is a two-step process. So the kind of ranking of the research questions will come as the next step. So please just feel very free to throw in there whatever through your experience or networks is strikes you as an important issue. And what's more, we'd really ask you to please share the survey through your networks, and perhaps we can make a link for that in the chat, or you can follow these links here. So with that, I think we're coming up on time, and I just want to take the opportunity to really thank all of the presenters, thank all of the people who are doing amazing work in this area. It's occasionally kind of heartbreaking to watch, but also really exciting to see the potential in terms of the contribution that sanitation workers can make in achieving SDG 6.2 on safely managed sanitation, for all of which we're going to need a lot of workers. We're going to need to figure out how to make sure their conditions are safe and dignified, and how we can attract more people into the sector. So with that, I think we will wrap up, and thank you all for your contributions today. Enjoy the conference. Goodbye.